I'm Isabel.
I'm Allie.
I'm Abby.
I'm Samantha.
I'm Brooks.
I'm Brandon.
And I'm Kaylee, and we're professional athletic training students at the University of South Carolina. This video is going to go over how to use a scoop stretcher for a C-spine injury.
Most often, C-spine injuries occur due to an axial load to the head. However, if you're unsure of the mechanism of injury or if a head injury is suspected, you should use a spine board such as a scoop stretcher for any of the following reasons. If there's an obvious deformity along the spine, if there's palpable pain along the cervical spine, if the patient has an altered state of consciousness or loss of consciousness, if there's an altered sensation to the limbs, and if the patient has altered motor function.
Okay, so we've determined that our patient has a C-spine injury. So the first thing we're going to do is the head clinician is going to maintain inline stabilization of the C-spine. You can do this either with the trap hold or scooping around the ears. We're going to avoid the trap hold in this situation because when the scoop stretcher comes in, it might be hard to move your arms. So we're going to maintain C-spine, and then I'm going to direct each of these people to do something. So I'm going to have Allie call 911.
I'll call 911.
Brandon, get the emergency equipment.
I'll get the emergency equipment.
Sammy and Abby grab the spine board.
And we'll grab the spine.
And Brooks do the neurological testing.
Can you tell me which arm I'm touching?
Right arm.
Can you squeeze my fingers? Can you tell me which leg I'm touching?
Right leg.
Can you push down on my hand? Can you tell which leg I'm touching?
Left leg.
Can you push down into my hand? Can you tell me which arm I'm touching?
Left arm.
Can you squeeze my hand?
Okay, so by this time the scoop stretcher would have made it to you. So what you'll do is you'll unclip the scoop stretcher at the top and the bottom. And you'll line the divots in the board up with the patient's head. If the patient's taller, you may have to lengthen the bottom to make sure that their feet stay on the board. So what you'll do is you'll come in at an angle and scoop to clip the top, maintaining inline stabilization the whole time. So maneuver her arms across her chest. And clip at the bottom. Then you'll tighten the straps from the feet up. And you're done.
At this point, after the patient has been successfully loaded onto the scoop stretcher, you'll need to make sure you use a C-collar or some other form of stabilization to keep the neck aligned during transport. A scoop stretcher provides significantly less flexion during application and increased comfort for the patient, but it's important to note that it does have some limitations. This can include a weight limit of 350 pounds and a slight height limitation due to the length of the scoop stretcher.